Big money demands for healthcare. Four of Canada's premiers came to Ottawa on Friday with a massive ask, an increase of $28 billion a year in healthcare transfers, meaning instead of just covering just over 20% of spending, the federal government would cover about 35%. Oh, right. They also want about $100 billion over 10 years for infrastructure. Look, the government has already given provinces $19 billion for the Safe Start Fund, but premiers, I guess they want a lot more. And with a projected deficit of over $350 billion already, can the federal government afford to meet these provincial demands? And will things like universal Pharmacare be enough? Let's find out. Joining me now is Alberta Premier Kenney. Premier Kenney, always a pleasure to have you on the program. I appreciate it. This is a big ask that the premiers want from the federal government, who are facing their own $350 billion deficit. Is this money on top of the $19 billion the federal government has already given the provinces for the Safe Restart?
Yeah, this is about long-term support for Canadian healthcare. It's the $19 billion was a one-time expenditure related to the COVID crisis, but frankly doesn't come close to covering provincial expenditures in that area. Our message, unanimously, 13 provinces and territories, different regions and parties, is that the top two priorities of Canadians are protecting lives and livelihoods, healthcare and the economy. We wanted to put our flag in the ground that this is the key federal national priority right now for Canadians. As opposed to some of the kind of priorities we've seen floated as possibilities over the past 3 weeks out of Ottawa.
Well, so let's talk about those. Jagmeet Singh, for example, has said, I think universal Pharmacare is a big deal. Some say so what about that? What if they said, look, we want universal Pharmacare. And by the way, provinces, I know you want no strings attached. When Paul Martin had the quote fix for a generation in healthcare, he had strings attached on things like wait times. Would you be satisfied if they put billions of dollars in universal Pharmacare to help people pay for drugs?
Well, frankly, no, Evan, because there is already many different approaches. Some provinces already have quite generous Pharmacare programs, others have virtually none at all. In Alberta, we have a unique need, I believe, in mental health. We're surging unprecedented resources to support people coping with mental health challenges. The federal government can be most helpful by coming to the table with its fiscal depth. Many provinces, we are very constrained. I'll tell you, Evan, to be blunt, there were a few weeks there where we couldn't sell Alberta government bonds. We weren't the only provincial government in this crisis to face that situation. The federal government is not so encumbered. And so really what we do need is that flexibility that allows us to address our local needs.
Okay, well, you know, was there any irony for you being in Ottawa with, you're beside Doug Ford, a fiscal conservative, and Brian Pallister, and you, all conservatives, saying, hey, government, you're already in massive debt. Not only do we need $28 billion more for healthcare because of the shortages, but we'd also like $10 billion a year more for infrastructure for 10 years. That's $100 billion, plus the $19 billion we already have, plus the fact that there's lots of infrastructure money that hasn't already been spent. Like, isn't there a moment where everyone's kind of like, wait, who's the conservative in the room here?
You know, Evan, I've never believed in what I've called begging bowl federalism. This is not begging. This is money that, particularly with respect to fiscal stabilization, Albertans have paid into the system for decades. We've contributed over $600 billion more through our federal taxes to the rest of Canada over the past 50 years than we've received back in transfers or federal benefits. And so from my province's perspective, we're saying we've done our part. We've been generous. And now in a time of real significant need, particularly on the healthcare front, but also in the jobs front, we need to see some of that generosity returned.
Let me just press back a bit on equalization. And first of all, I'm never going to diminish the pain Albertans are going through. It's been a perfect storm for the people of Alberta. I absolutely appreciate that pain, and I would never minimize it. But just on the equalization, and there's politics involved. You say Albertans have paid into it. You don't pay into equalization. Alberta's had the highest per capita income, and by the way, it remains so in the country for years, and that the tax goes into a fund that becomes equalization. It's not like you've paid into it. It's just that's the revenues that have been very high in Alberta. So, and I realize that you can't change the equalization, but it's not like it's been unfair. You were part of the government that renegotiated it. So I just wonder, are you playing politics with this, like it's Alberta's getting ripped off when the system has worked for Alberta in good times and you signed off on it?
Well, Evan, if you roll the tape back, I'm pretty sure I didn't say equalization. I said that Albertans have contributed through their federal taxes $600 billion more to the rest of the Federation since 1960 than they received back in federal transfers or benefits. And that is absolutely true. It's not just equalization. That's a big portion of that, but it's the whole system of fiscal federalism. And yes, it's because we have had higher incomes over most of that period. And we do not begrudge having been able to share much of our good fortune with the rest of Canada when times were good in my province and not so great in other parts of the country. But there is supposedly in this federation, there is supposed to be, the same federal government that transfers that money to have provinces is supposed to be there when provinces like resource-producing provinces suddenly find themselves at the bottom of an economic cliff.
Premier Kenney, always a pleasure. Thank you, sir.
Thank you, Evan.